Welcome to another episode of Global Health Dialogues with Princess Dina, where we explore the people, policies, and partnerships shaping the future of health equity. Today, we are honored to speak with one of the world's leading voices in pediatric oncology, Dr. Carlos Rodriguez-Galindo, Executive Vice President and Chair of the Department of Global Pediatric Medicine at St. Jude Children's Research Hospital and Director of St. Jude's Global. From conflict zones to cancer centers, Dr. Rodriguez-Galindo has been at the forefront of ensuring that every child, no matter where they live, has a fighting chance against cancer. As we speak, approximately 400,000 children and adolescents between the ages 0 to 19 are diagnosed with cancer. The tragedy is that despite great advances for cancer cures for children, there is a huge inequity. As we speak, a child who has leukemia, for example, living in the US, for example, in a high-income country, has an 80 or 90% chance for a cure. However, if that child lived in a low-middle income country with the same disease, that child will have a measly 20% chance for a cure. So today, we will be discussing the global burden of childhood cancer, the leading role of St. Jude's Children's Research Hospital in fulfilling its first founder's wish, Danny Thomas, who prayed to the St. Jude that no child should die in the dawn of life. And we will also be talking about the powerful role of partnerships, real partnerships to change the status quo, and what it takes to deliver cancer care amidst crises and deadly inequality. Firstly, I would like to comment, Dr. Carlos, about your personal and leadership journey. You began your association with St. Jude in 1994 as a postdoctoral fellow. Later on, you went to Dana-Farber and Boston to work there. And I just want to take a side turn. These two institutions hold a special place in my heart because that's where our son, Rakan, did a successful bone marrow transplant there. And then later on, you did full circle after a stint at Harvard as a professor. In 2015, you came to lead and direct St. Jude Global. What inspired your transition from clinical practice into global pediatric oncology leadership?
Thank you so much for this question. I don't know where that started, but I think that in this world, what we are doing, all of us that try to build a better future for children with cancer, started at some point, with this long journey that we all try to identify our goals, our purpose, our place in life. And my life, my journey started with that as well. I wanted to be the best doctor for my patients. I wanted to be the best pediatric oncologist that I could be. That was my simple and at the same time kind of complex goal. And while I was at St. Jude and then in Boston, that's what I was trying to do, be the best doctor I could be for my patients, build capacity, build programs, do research, try to develop better treatments. But along the way, I always realized that this was not complete, that I needed to build whatever I had to build for all the children, because for me, and as it is for you, curing childhood cancer is a lofty goal, but we can only cure childhood cancer if we cure the children that have cancer. And these are two different concepts. And so that means making it global. And so along the way, I started working with programs in countries with limited resources, trying to how to adapt the treatments, how to build that capacity. And then the opportunity came about 10, 12 years ago when Dr. Downing, then the scientific director of St. Jude, I started thinking, how should we continue to build that global capacity at St. Jude? And I remember that in a conversation with him when he was visiting Boston, because he was part of the Harvard Cancer Center External Advisory Board. I remember that conversation when I don't know, Jim. I don't know what is the place, what is the route for that, but this is the challenge. That is the next frontier. That's how I remember saying it. How to address the global challenges and inequities in childhood cancer, to me, is the next frontier. And that basically eventually took me to my job right now. And St. Jude thought, okay, let's talk about this. Let's see how we can once and for all advance care for children with cancer globally. And to me, when that opportunity came, I thought it was all my life I had been working for this. I did not know it, but when that opportunity came, I said, this is a dream job. It's the most challenging job I will have ever had, but I think it's a dream come true to be given the gift of being helpful. Yeah,
that's amazing, and it is the most, like you said, it's the most challenging job. And I'm sure your family don't see you a lot. We'll have a chat with your wife or another time, but it's also the most meaningful job. And I'm so glad that you took that challenge, because really the children of the world need you. But I wanted to ask you something. I know that the sort of formal structure of the global work of St. Jude started in 2015, and you were the first, you gave it a name and a department, and you were the first to direct it. But St. Jude actually was starting working from 2004. The reason I know that, that's when I was the first ever Director General of the King Hussein Cancer Foundation. And I remember the first thing I did, because, I had heard about St. Jude. And of course, being a mother of a cancer survivor, who doesn't know about St. Jude? And I remember thinking, we're not going to reinvent the wheel. So I literally took myself, hopped on a plane, came to Memphis, Tennessee. I was 7 months pregnant with my third child, Jafar, and stayed in one of the Peabody hotels. Very fortunate to see the mama duckling and her little ducklings coming
yes,
down the lift, and everybody's waiting for them. And then I would say I spent the most important week of my life, actually, because first of all, I was invited by the late Richard Shadiak Sr., who was such an amazing mentor for me personally, and for the team back home. And I literally was like a student with pen and paper. I learned everything about governance structure of St. Jude and why it works, and why it is powerful to be that way. At the same time, I learned everything about fundraising. I sat down with the corporate team, with the marketing team, with the communication team, literally like a student, absorbing and writing notes and so on. And then when I went back home, the same people, I was able to write to them, call them if I had a question, etc. And honestly, that week was like better than a master's or a PhD course in fundraising and governance. And when I went back home, I literally implemented every single thing. And our governance actually almost copy and paste of your bylaws.
Yes, yes.
And it was pivotal. It was pivotal in the success of the King Hussein Cancer Foundation and Center that you know of today. And everybody knows now that the King Hussein Cancer Foundation has become the largest grassroots fundraiser, not only in Jordan for cancer, but also in the region. So, but I have to say, it's because of this reciprocal collaboration, the fact that St. Jude opened up its books and allowed us to come and learn and share and be a mentor for us. That's, I think, what distinguishes St. Jude's partnership from any other. So I know we were not the only ones that you worked with prior to you heading this, but when you came, what learnings did you get from all the other global work that you already had started? And what other sort of systems in place and learnings that you took to this new St. Jude Global in order to implement better cancer care in low middle income settings.
Yes.
What were the pillars of your
Yes,
program?
yes,
etc.?
yes. You bring up a very important point. So, yes, exactly. As you said, St. Jude had been committed to advancing care globally and address some of these disparities for many years. Actually, the first programs started in the 1990s. But let's remember that during those years, the global health agenda was mostly focused on infectious disease, HIV. We're in the middle of the HIV pandemic, so HIV, TB, malaria. And so for an institution like St. Jude to start working on addressing global disparities on childhood cancer was kind of unique. And so the program started as a philanthropic humanitarian effort, working one-on-one with different organizations, with hospitals, with foundations, trying to somehow replicate the St. Jude model, which is that symbiotic relationship between a not-for-profit organization that dedicates resources, intellectual capacity to patients globally, but also with a foundation, with ALSAC, that grassroots movement that inspires so many around the U.S. and around the world to dedicate resources and time to children with cancer. So that was a unique model. And so in 2004, when you came to St. Jude, you were able to experience that model. And so we used to call it then the twinning partnership. So we twin, and so twins are twins for life. You do not split twins. So we have the same genes, we have the same passions, the same habits. And so for us, that twinning relationship meant a lot. And as we then grew, and then in 2015, we had to make a change. The change was not to undo anything. The change was just to think, how can we scale it up? How we can make this a true global movement? How can we bring that twinning partnership to a global partnership that will accelerate, would disseminate, would scale up? And so one of the lessons that we took was this: we would never sacrifice the relationship with our partners, with the institutions, the medical institutions, or with the foundations. We are a hospital working with hospitals. We are physicians, we are fundraisers, we are nurses, and our focus is the patient. And so we are not an Institute of Global Health, we are not a Ministry of Health, we are not a school of public health. We are a hospital, and that to us is critical. So the patient is at the center of everything that we do. We are obsessively focused, if you wish, on the patient, and we try to address the entire continuum. So that's the first lesson that we took. So we could never sacrifice that. And that basically has taken us to what we call now the St. Jude Global Alliance, which is in partnership with today about 400 institutions and foundations around the world. We try to bring that meaning to each one of those. But then to make it more scalable, we had learned along the way that we had to look at what we call the macro system, work with governments, work with global agencies to make sure that what we do is sustainable, it's scalable, it can have that impact, sustained impact that we want. As we then became a collaborating center for WHO, together with many partners, we launched the Global Initiative for Childhood Cancer, etc., right? So, and that was the model.
And I am a witness of that, really, because I was director for 16 years, so of course I was working hand in hand with the center, obviously, and your education and workforce development programs, capacity building and strengthening the human infrastructure, that was huge. The fact that you utilized telemedicine and supported us with virtual tumor boards for second opinions. I remember, I think for KHCC, there was once a month tumor board for second opinion cases, and once a week, a learning telemedicine link up with the center about oncology nursing and so on. You even helped us you even opened up your hospitals to give fellowship programs for our doctors so they can be exposed to best of the best. So that's really huge. And also, let alone, of course, the fundraising support that I spoke about. And I want to say that our partnership continues to this day. Last of which you co-chaired the gala for fundraising in Washington, D.C. So, that's what I love about St. Jude, is that your partnerships are very invested, very committed, and really outcome oriented, like you said, because if you feel that St. Jude wants what's best for the patient, they want to make a difference. And with your partnership, certainly that was the case. And you also, I think, other pillars of your program, how do you use your global data to drive policy and improve survival outcomes?
Yes.
That is a question for you.
Yes. So then as we started building this capacity, we had to develop a good strategies, as you can imagine. So we have engaged over the last decade in cycles of a strategic planning, trying to think about how to bring data into what we do so that every decision, every action has to be based on evidence. And we need to generate some of this evidence. We need to analyze some of this evidence. And so through St. Jude Global and through our Department of Global Pediatric Medicine, we have created processes, tools, platforms that allows our partners and us to identify or define the problem a little bit better, then design the interventions that might be needed, and then implement those interventions. So it's an entire process that brings different kind of research methodologies into that continuum. But part of that includes as well policy. So we have policy science kind of driven interventions that we do at a national level, working as well with governments to identify the right interventions through policy making and stakeholder engagement. So that's when, research, science, knowledge generation is important as well in global health. So we just need to define the field. We need to create those opportunities and then implement changes based on that. That can be, from patient data to policy data to health systems data to, health services data. And that entire continuum is critical.
And you're in a great position to provide implementation evidence and science, because I know in many, certainly when I was director general or in many of the conferences that I attend, sometimes I find that a lot of the partnership is, the main goal is to publish, and sometimes I get annoyed. Okay, you publish, but what about the people on the ground? Are we going to do something about it? But in St. Jude, I feel like you do the full cycle. Like you said, you do the practical stuff, you help the people on the ground, you mentor them, you support them, etc. And then you publish and utilize the data to share. And what's so amazing, you have created solid global networks in every single region. I know in my region, we have KHCC, we have the Lebanese Cancer Center and other centers collaborating in a big way, supporting each other, sharing knowledge, and so on. What success stories do you have and lessons from partnerships, whether in Africa, Latin America, different regions of the world? Can you give me some examples or tell our listeners with some real life examples?
Yes, obviously I'm very proud of some of the accomplishments that our community, is not about St. Jude, it's about our partners, have been able to accomplish. And I think that when I see the real success of the programs is because we have been able to bring multiple partners around the table, and that combination of working at the government level with the World Health Organization and other global agencies, with partners and foundations, that is when the magic happens. That's when everything happens. And we have many stories just to show that maybe, I started earlier, we were just talking about that macro system and the micro system, but we have so many examples of initiatives that started just with a conversation around the table with our partners because of a need that they exemplified. For example, in Africa, one of the main needs when we started working on some of the programs was, please help us, optimize guidelines. We don't know oftentimes which treatments to use based on what has been published. Can we come up with an adapted and adaptable platform that would allow us at any given time optimize the treatment that we deliver? So that initial conversation took us to what today is a huge global platform that we call ARIA, that we developed at St. Jude together with SIOP, IPSO, PROS, and CCI with parents organizations. And now we have a platform that provides adapted guidelines for everyone, whatever that person might be. And that may be an example of how to bring a conversation with a group of stakeholders to a global platform that hopefully everyone can benefit. We have other initiatives that we have done at the bedside with, for example, early warning scores, how to identify children at risk of deterioration. We started the same, piloting a new model in Guatemala. We took it to all Latin America. And from there, actually, the Pan American Health Organization now uses those recommendations in their guidelines for governments. And we have many examples of taking things from the conversation with partners all the way to global engagements or to governments.
And do you feel, for our listeners who don't know about the Global Initiative for Childhood Cancer, I just want to say that St. Jude co-launched with WHO in 2018 this initiative, this global initiative, with the goal of achieving at least 60% survival rate for children with 6 of the most common cancers. And as you have heard from Dr. Carlos, this, St. Jude, while St. Jude was doing a lot on its own before, but with this co-launching with WHO, it has positioned St. Jude as the leader globally and elevated its influence, shall we say, globally, to be talking to governments and other official people in this landscape to be able to make things happen. So what other things, where are we with that initiative now, would you say? You told us about 2 successes that you've done, one in Africa, one in Latin America. I heard about the platform for access to medicines that you have also launched, and you have committed 200 million over 6 years to that initiative. Where are we now? I remember hearing that KHCC King Hussein Cancer Center was to receive 1 million in free medication. Can you tell us more about that and who benefited?
Yes, this is, thank you for bringing this up. This is a great initiative. And I said one of those challenges that we all have, as you mentioned. Probably everything started with a global initiative for childhood cancer as we tried to bring, 6 years ago, 2018, so 7 years ago already. So from that micro system to the macro level, how might we engage governments in a meaningful way? And that's how we started working with WHO, us and many other organizations, SIOP, CCI, many other organizations. At the end, were close to 200 partners working on that. But we realized that if we wanted to make things sustainable, we needed to engage global agencies, and WHO completely embraced this proposal by all of us and has accelerated that global movement whereby governments now prioritize childhood cancer as part of their national cancer control plans. And so with that, then we started realizing that one of the main issues, we all know that around the world, is access to quality medications. And so, and this is something that as we work through the GICC, I believe 80% or more than the countries that are engaged in this process have asked for a solution about this. And we all know that many children around the world right now, today, the majority of children actually that are receiving treatment for cancer cannot receive a continuous supply of medications. And in many times, the medications that they receive out of poor quality. So bottom line is that a number of years ago, we started thinking about this as well. What is the problem? Number one. Um, what is the solution? Number two. And then if there is a solution, what should we do to realize it? And so these are big problems asking for big solutions. And I remember in one conversation early on with a team from UNICEF, one of the UNICEF partners said, well, there are no challenges. What we don't have is an action plan. So I think to me that was very important. Let's not talk about challenges. Let's talk about a lack of an action plan, which puts you to actually work immediately. Bottom line is that we created this global platform for access to childhood cancer medicines, which is basically a global central procurement mechanism that works at a multi-stakeholder engagement with the central office, if you wish, the secretariat at WHO, engaging with governments, developing that health systems strengthening path, with the procurement agencies that are the UNICEF Supply Division and the Pan-American Health Organization for the Americas. And so, in a nutshell, basically what this platform does is create a central forecasting and procurement mechanism that then works with all governments to make sure that the governments have that pathway completely strengthened and optimized for the children to receive medication. So it's not just a free medication process; it's an entire health systems strengthening process. So, as you said, St. Jude committed to launch it as a proof of concept, $200 million over the next few years to make sure that we can show that this is possible. So then we will think in 2 or 3 years, we're already thinking about developing a multi-donor trust that will help with sustainability. But in the first 3 years, we were planning to do 12 pilot in countries representing the different WHO regions. And so, yes, Jordan is part of that first group of 6 countries. And now we are launching it to the next 6 countries. So by February, and that was good because of our Childhood Cancer Day, coincidentally, the first 6 countries started receiving the medications. And so we are already proving that this is possible, that through this central procurement mechanism, we can deliver an uninterrupted supply of quality essential medicines. And now we are starting with the next 6 countries, and hopefully we can scale it up over the next 5 years to up to about 50 countries, serving in total about 120,000 children by the time we complete that. So that's a good success story as well of the global community.
Yeah. And I just want to say this is on top of the $15 million that you first paid into when you co-launched the initiative, correct? This is on top of that.
Yes. So the Global Initiative for Childhood Cancer, as you know, is a separate initiative. We continue to support financially the Global Initiative with additional resources, but this is separate from the global platform. Yes.
Well, it is amazing, not for St. Jude, not only just to lead, but also, to put money where, as you say, the saying goes, where its mouth is. The fact that you came in with the money to deliver and create proof of concept is so huge and so helpful that it will be difficult later on, or for others not to join. Really, I am sure once you start your multi-trust donor fund, people will join because people also love to be on a successful wagon. They like to ride on success as well. I just want to go back a little bit about the partnerships that you've had with cancer centers all over the world. And certainly our experience at the King Hussein Cancer Center and Foundation was such a model partnership that, to be honest, I haven't seen personally. I haven't witnessed elsewhere. What do you look for partners? I know when this is what I tell people when I was president of UICC and I was traveling globally. For example, I said, many centers in the world or countries, they sit down and wait passively for support. They think, we're waiting for this organization to come and do everything for us. And they don't realize that it doesn't work unless the local ownership takes place. And I think that's what happened at the King Hussein Cancer Center. Is actually, I saw the before and after, because when we first came in 2002, we had heard some rumors about St. Jude trying to help with the pediatric department and so on, and they were not happy, etc. And that's when I came in 2004, and then I visited St. Jude to learn what's going on and what's happening and learn about governance and fundraising, etc. So when we owned up to our part of the deal, then I felt that that's when, we fast-tracked the partnership and we went from strength to strength. And is this the kind of, what other examples of local ownership that you have experienced elsewhere successfully? Or what would you like to tell other cancer centers, the key issues that you would want them to prepare on the ground so that it can be, so they can facilitate the support that you are giving?
Yeah, this is a good point, a very good point. We have a very open process for partnership. At the end of the day, I'm not trying to be arrogant or whatnot. We want to make sure that wherever there is a child with cancer, another catastrophic disease, St. Jude is there. So in a good sense, meaning that we have been able to influence the care that that child receives through different mechanisms, whether it's because we have strengthened the WHO relationship of their government or because we are present through partnership with the institution and the foundations. And so whatever there is an institution that is committed to the care of children with cancer, wherever there is a foundation that is committed to supporting those children, we're open to engage and support. And then as we start that process, it's a very bi-directional, relationship. We want that this relationship is very collegial, if you wish, but also that everything that we do is in a co-design exercise. We don't want this to be a top-down that doesn't build, trust and long-term relationships. So obviously, it's a process, but we want to make sure that we listen, that our partners are completely engaged in this process, and then we build capacity together. So we have multiple opportunities, as you know, whether it's through education, through some of the packages that I mentioned that help generate evidence and do implementation of some of the practices or the innovation. We do projects that require a bit more of a research engagement, and then with the foundation. So wherever we are, we always work with grassroots organizations, with foundations, with parents groups to make sure that that link happens. And so we are quite open on that, quite engaged, and we love to have that bi-directional relationship with our partners.
Yeah. And we have certainly felt that. I mean, it is a two-way thing. How many staff do you have at this St. Jude Global Health? I mean,
yeah.
And how much money? Maybe you're not allowed. Maybe you're not allowed to say that.
I may not mention the money, but I may just mention the staff.
Yeah.
So well, number one, about in terms of money, I think that what I can say is that we're very fortunate that our institution, the leadership of the institution, our CEO, the leadership of ALSAC, the CEO of ALSAC, the board of governors and board of directors of our institution have seen the need and are completely behind on integrating global goals as part of who we are as an institution. And so that to us is a gift. So to work for an organization that sees that the global reach is part of who we are as an organization, not an afterthought, not a pilot, not a humanitarian effort, but just part of who we are essentially as an institution, and that we want to end global disparities of childhood cancer the same way that we want to advance research to to understand the intricacies of any specific disease. So with that said, then yes, the budget is part of what the institution develops, and so obviously we have a sustained budget support that allows us to plan, to execute, but obviously every dollar is accounted for, including what we support for the WHO on the global platform. But of course, we need
Yeah, it's
we need to show progress. So we need to show
exactly.
completion. And then answering your question about the staff, we are about 240 staff right now here at St. Jude, and that includes our staff here. And we are actually opening regional hubs as well. So in the next few years, we will see offices with staff in different parts of the world to be closer to the problem, to be able to engage more directly with partners and governments. And that's a business model that we're implementing moving forward to be closer to where the problem is.
This is truly amazing because St. Jude is rolling up its sleeves and really going on the ground. And that is the way to do it. And this is such an amazing signal from everything that St. Jude has done, from its work starting from the 1990s to then opening up or formalizing the global work into St. Jude Global, and then entering the global co-chairing the Global Initiative for Childhood Cancer, and then the platform for access to medicines, and now to even open regional hubs with offices and so on. I mean, really, that is so admirable. I know Danny Thomas, the founder of St. Jude, the U.S. Lebanese national, he will be very happy to know that his first wish is not only being fulfilled one time, multiple times, to make sure that really no child dies at the dawn of life. And then one more thing that St. Jude has taken up is that you're also supporting the continuity of cancer care in conflict zones and humanitarian crisis. We all know that cancer doesn't pause for war. In fact, cancer thrives during conflict. Why? Because all the weapons and ammunition that we usually target against cancer disappears from availability of surgery, radiotherapy, chemotherapy, medicines, hospitals, etc. all disappear, which of course gives cancer a free rein to ravage the bodies of children during times of conflict. So what does it take to deliver pediatric cancer care in conflict zones? You know, given all the geopolitics and the chaos and everything that goes with that. I know you coordinated evacuations and supported continuity of care, Gaza, Ukraine, Syria, etc. Can you give us a glimpse of what it is like, all the sort of challenges and the landmines that you have to walk on to be able to help cancer patients?
This is a very complex and complicated problem that we try to resolve. But I want to start by saying that when we started engaging in the resolution or the support of pediatric cancer programs in situations of conflict, we realized that the world had not set up any system for that. It was very frustrating to see that despite the many conflicts that we face, there was no system in place to support the care of children with cancer, children with catastrophic diseases, children with illness. And so there was no one single organization that actually had figured it out. And so we started helping just like we tried to help our patients. So as we said earlier, our focus is the entire continuum of care for a child with cancer. And whenever there is a child that suffers from cancer, we want to be part of that journey. We want to make sure that child is not alone. It's never felt alone, and the parents are not felt alone or don't feel alone, or that the physicians, the practitioners, the people that care for these children have the support that they need. It's much easier said than done. And so we started working first with the Syrian crisis. In that case, it was more a financial support, working with Jordan, with Lebanon. But then with Ukraine, things became a little bit more complex because we had to organize then, say, the evacuation, the referral of more than 1,700 children over a couple of years. But that was also a good example, and you asked me earlier about good examples of success of those partnerships that we develop with institutions and foundations. At the end of the day, what we wanted to do is support our partners and bring together the partners in the region that are part of our journey. And so with Ukraine, for example, with Syria, we brought the partners from Jordan and Lebanon. When we started the program in Ukraine, we had to figure out how to do that referral and evacuation, but we work with our partners in Ukraine, in Poland, in other parts of Europe to facilitate that. And most recently with Gaza, with the partners in Egypt and Jordan. So our role in these cases has been, we have learned over the last few years on what is needed and how to do it. It's more about coordination, about some of the logistics, on how to bring all these partners together and facilitate that process. And so with Gaza, we have helped as well evacuate, transfer to a place where these children and these families can receive care, more than 250 by now children as well. And it's complex. I don't say that it's an easy process. It's complex, but I feel like we are getting close to that point where we can develop a good package that we can generate to then bring multiple organizations, WHO, governments, private organizations, partners on the ground to facilitate that process. It's new, it's complex for us, but at the same time, we could not say no. We could not just walk away. It's like you cannot walk away when you see a house in fire and you have your family inside, right? So you just need to
Yes.
put a practice together, start yourself, and then bring a solution to those in need. So that's how we have tried to operate that.
But like you said, picking up on what you said the Ukraine was complex, but also a success story because you had a lot of good. I mean, we all know in the Ukraine there was a lot more countries really rallying together to support Ukraine in dealing with refugees in general, in helping coalesce the aid together between various countries. Whereas, as we know, for example, in Gaza, where the Fourth Geneva Convention that was meant for the protection of civilians in times of war and healthcare personnel, healthcare facilities, etc., is dead and buried, as you know, targeted and all. The only cancer center for pediatric cancer care that was established by the Palestine Children Relief Fund was bombed, etc. So Gaza was a different, shall we say, example. So you have that example, extreme case where nothing could work certainly on the ground except for evacuations and referrals. And that also had its many complexes. But I just wanted to ask you, for the Ukraine, for example, where you had a bit more of a geopolitical, better landscape, shall we say, were you able to manage continuity on care in Ukraine itself, or did you have to evacuate everybody out to neighboring countries?
Yes. So, yes, I completely agree. These are very two different scenarios, unfortunately. I wish the global community could respond equally, whatever that conflict is. In Ukraine, we had two differential factors. One was that the European Union and the European countries provided full refugee status to all these families. And so as these patients moved out of Ukraine, they would receive free care, free family support, full access to citizens' rights to these children and their families. And so for us, from that point of view, there was a net that was supporting these children and these families. throughout Europe. And so we work with many partners, governments, and professional organizations to help place these children across Europe, while at the same time supporting the capacity within Ukraine. Yes, many children were able to stay in Ukraine, but in the first year, 2 years, the majority of children with new diagnoses were offered the possibility of evacuating just because there was no possibility of predicting what would happen. And so many of these children would not be able to continue care. And so now the most of the children stay in Ukraine. Only those with unique special diagnoses or needs may be evacuated through the systems that we have in place through Poland, and then from Poland to other parts of Europe if needed. Gaza is very different, and we all know that the situation in Gaza is much more dramatic, with um, less respect for the rights of these children, these families, as we'd say, and much more complex, logistically complex evacuation process. As you can imagine, as you know, we work with the State Department, with the Israeli government, with the Palestinian Authority, and the governments in the region to facilitate this transfer. As we speak today, one child with a very advanced leukemia that required immediate transfer. As we speak, I heard this child probably now has reached KHCC, but it was through collaboration of all these three governments, the Palestinian Authority, Israel, and Jordan, to facilitate the transfer of these children through Israel into KHCC. And that's been a good lesson for us that, there is always goodwill everywhere. And so, and a child with cancer, um, uh, hopefully and almost always brings the best of us, whether it's at a government level, at a practical level, on the ground. I think all of us try to rally behind these children. And this has been a good story as well for Gaza, for Ukraine, or for Syrian refugees.
Yeah, but definitely the numbers from Gaza have been very little compared to elsewhere because of the difficulties and, the genocide taking place there. But anyway, I just wanted to ask you, given now your experience from the Syria conflict, Ukraine and Gaza, and we all know that the infrastructure for humanitarian relief during times of conflict actually has always been not focused on non-communicable diseases. So we're talking here about cancer patients. There wasn't much in the systems in place for diabetes patients and other kind of, like you said, catastrophic diseases. So now that you are with the Global Health Initiative for Cancer, are you able now to put systems in place or to advise globally and advocate for, like you said, not after the fact system, but integrated systems that help children with cancer so that we automatically, or the people with any conflict that takes place, people on the ground and humanitarian organizations and governments know that what needs to be done and what are the pathways and the things, the do's and don'ts, shall we say? Are we closer to that?
Yes, yes and no. Yes, in the sense that the last few years, I think that the community, including us, WHO, governments, and other organizations, have, I believe, we have started to put a process in place that can work in many scenarios, not in all the scenarios, but also the realization that this takes many actors, that we need to involve global agencies, refugee agencies, governments, medical institutions. And I said what we learned from Ukraine allowed us to immediately start acting whenever the war in Gaza started. So immediately within 24, 48 hours, we had already the skeleton of what eventually became that effort to evacuate all the children with cancer from Gaza. So again, we have all learned during this process because there was this huge gap in knowledge. It's complex because it's not always easy to replicate what you see in Ukraine with what we see in Gaza and maybe later on in other areas. But I think that we need to continue to work towards that and figure out who's responsible for what. It requires us assembling a team that involves international relief organizations, international organizations such as WHO, institutions like St. Jude and others that can help with the logistics and the continuity of care. But it's complex because not the same principles and practices can be applicable everywhere, as you know. Yeah.
Here, everybody should really uphold the Geneva Convention in all conflicts, civilians and healthcare personnel and facilities and humanitarian organizations, they should be protected. And I think this is where, personally, I felt a little bit disappointed, hugely disappointed, that a lot of the global health communities that I knew, they were silent in terms of, we should all be up in arms saying, please, for whoever it is, even for the devil incarnate, the Geneva Convention should be upheld without question so that civilians are not affected. But that's another, that's a call for the world, really, and for the global health community to voice that voice loud and clear. If you had one message to give to governments and donors and global health leaders about childhood cancer, what would it be?
I think that you started by using the word rights, and so referring to the rights of children during the times of conflict. And I like to always, as we engage with governments, also use that word, the rights of children, the rights of children to a better future, the right of children to a cure, the right of children to a life. And that is the start of the conversation most of the time with governments. I then usually like to make sure that governments see that there is a path forward, that this is not just a pie in the sky, that we have a solution for this, that for children with cancer and other catastrophic diseases, there is in fact a way to move forward. We have shown that there are processes and systems that can be placed to increase the capacity to strengthen the health systems at a country level. We have also shown that investing in childhood cancer is cost effective, that investing in childhood cancer actually for a government generates a return of investment. If we use those terms as well. And so in some modeling that we did a number of years ago, we showed that every dollar that we invest right now, a government, in strengthening care for a child with cancer will come back multiplied by 3 in a few years, because we're saving lives of the children that represent our future. And so therefore that there are sustainable models that can be implemented and that this actually can change the world. And so for governments, I always tell them there is a problem, there is a solution, and we are here to help you implement that solution. So,
and I think this is exactly what the lady told you when you were thinking about access to medicine. She said, we don't have challenges, but we don't have an action plan.
Yes.
And this brings us back to the importance of national childhood cancer plans. And I know St. Jude supports governments to do that. And like you said, what's really great about cancer plans is that it sort of puts everything in paper, and you start moving forward. You start ticking the boxes 1 year at a time. So it in a way minimizes the overwhelming nature of having to do everything at once. And it helps you feel that it's doable and that you can move forward. Talking about man-made disasters like wars and crises, I know that for pandemics, St. Jude stepped up to deal with COVID-19. Because I remember thinking, as a mother of a cancer survivor, when everything shut down and nobody knew what was going on, etc. I remember thinking, oh my goodness, what happens with families who have children, and adults also fighting cancer at this time. So, what did St. Jude do? I know you took leadership in that. Can you tell us more about that?
Yes, it seems like it was long time ago and it was yesterday.
Yeah, I know,
Yeah.
I know.
And so it was one of those challenges that came overnight and we had to figure out, okay, now how are we going to respond to this? And so we recognized the same, that you see parents, providers, patients were a little lost. And so we immediately came up and with, okay, let's put together a global solution, a global platform. We created that the Global Observatory for COVID in Childhood Cancer, a place where first we created this registry. We work with SIOP, with many international organizations to create a registry that actually had a dashboard that anyone could monitor constantly what was happening with the number of patients, the outcomes, about prognostic factors, etc., etc. So we created that knowledge generation kind of platform, as well as a repository of information, trying to keep everyone up to date with what was happening, what were the new regulations, the new recommendations, and that was as well an opportunity as well to educate. And so our partners in Mexico came up with that after a few weeks, a few months. They said, cancer cannot wait, neither can we. And so that was basically our mantra. During COVID, cancer would not wait, so we could not wait either, right? So we had to continue to work and develop a response. And hopefully that created an opportunity for everyone to be together on the response against COVID. Yeah. Yeah.
Fantastic. And now we have, thanks to St. Jude, we now have a model globally
Yes.
to emulate for other pandemics.
Yes.
That's amazing.
Yes.
So, on a personal reflection, what has been one of your most humbling or, let's say, hopeful moments in your global health journey? One that made you feel that despite all the challenges and the work and the travel, etc., that it's all worth it.
Yes, and so thank you. I there's a story that I believe I have shared before. So, but I remember a number of years ago, I was talking with Professor Macera, who's a very well-known pediatric oncologist from Italy, now retired, who actually was the first one, probably in the 1980s, to start working with cancer programs in countries with limited resources. And so in the 1980s, he and his team started helping Nicaragua, which, as you remember, in the 1980s, Nicaragua and many countries in Central America were embedded in these devastating civil wars. And so I asked him, why in the 1980s? Why did you, of all places, decided to help cancer programs in Nicaragua, a place that was actually devastated by an ongoing civil war? And he told me that story that I have never forgotten, which is, and that changed completely how then I started working at a global scale. And so he told me the story that was in 1986 on Christmas Eve at Hospital La Mascota in Nicaragua, in Managua, that the director of the hospital, a pediatrician who also was a poet, Professor Silva, every night would just do rounds before going home. And during the days, if there was a child that could not be cured because of a devastating injury or because of cancer, he then would mark a cross next to his door so that the nurses, the other doctors would know that they could not dedicate resources to that children in a hospital in the middle of the war. Resources were very limited. And so day after day, night after night, he had to place a cross, mark a cross to any child that would come with cancer. That was 1986. In St. Jude, probably were curing already 60 or 70% of all the children with cancer. And so on Christmas Eve, as he was going home to be with his family, he just was walking in the halls and he noticed a young kid just tugging on his white coat, and he turned around and he recognized a 5 or 6 year old boy who, the day before, a couple of days before, he had diagnosed with acute lymphoblastic leukemia. And then he marked a cross next to his door. But most importantly, he also realized that this kid was an orphan that had lost both parents in the war. And so he was alone in the hospital with a diagnosis of leukemia, and he was going to die. And so he turned around and asked the child, "What do you want, my son?" And he said, "Please tell someone that I am here." And so that thing, "Please tell someone that I am here," is what made Dr. Silva realize that he could not continue to do what he was doing. He had to call for help. And so he called some friends in Italy that had been there a few weeks before. And those doctors actually responded to that, did not say, "Well, this is an area, this is a war zone, it's impossible for us to build that capacity." But yet these doctors, Professor Maced and others, decided, we're going to come, we're going to help. And to me, that "please tell someone that I am here" is the call that every single child anywhere is calling every day. And that's why I said, whatever there is a child with cancer, we want to answer. And I think that our community has answered to that. You have answered to that. St. Jude has answered to that. The WHO has answered to that. And I'm very proud that our community has been able to mobilize that. But "please tell someone that I'm here" is what I always remember from that experience.
What a human story. So touching, truly. And yes, this child was saying, "Please see me. I'm here.
Mhm.
I'm not dead
Mhm.
yet."
Yes.
And it's amazing, by asking, like you said, by asking for help, people will come forward to do what they can. Dr. Rodriguez, thank you for sharing your insights, your vision, and your unwavering commitment to the world's most vulnerable children. Your work reminds us that pediatric cancer is not just a clinical challenge, it is a test of all our global conscience and collaboration. Thank you so much for sharing your journey. And to our listeners, if today's episode moved you, please share, rate, and forward to others, and follow us for more conversations that amplify the voices that are reshaping global health.